How to treat influenza? Usually, you will need nothing more than rest and plenty of fluids to treat the flu. But if you have a severe infection or are at a higher risk for complications, your doctor may prescribe an antiviral drug to treat the flu. Lifestyle and home remedies. If you do come down with the flu, these measures may help ease your symptoms. Drink plenty of liquids. Choose water, juice, and warm soaps to prevent dehydration. Rest. Get more sleep to help your immune system fight infection. You may need to change your activity level depending on your symptoms. Consider pain relievers. Use an over-the-counter pain reliever such as acetaminophen or ibuprofen to combat the agonies associated with influenza. Children and teens recovering from flu-like symptoms should never take aspirin because of the risk of Raynaud's syndrome, a rare but potentially fatal condition. Antiviral drugs. Most people with flu have mild illness and do not need medical care or antiviral drugs. If you get sick with flu symptoms, in most cases you should stay home and avoid contact with other people except to get medical care. You might need antiviral medication to treat flu. Antiviral drugs can treat flu illness. Antiviral drugs are different from antibiotics. Flu antivirals are prescription medicines, pills, liquid, solution, or an inhaled powder, and are not available over the counter. Antiviral drugs can make illness milder and shorten the time you are sick. They also can prevent serious flu complications like pneumonia when treatment is started early. It is very important that antiviral drugs be used early to treat people who are very sick with flu. For example, people who are in the hospital and people who are sick with flu and have a greater chance of getting serious flu complications, either because of their age or because they have higher risk medical condition. Other people also may be treated with antiviral drugs by their doctor this season. If you get sick, take antiviral drugs if prescribed by a health care provider. Take everyday precautions to protect others while sick. While sick, limit contact with others as much as possible to keep from infecting them. Cover your nose and mouth with a tissue when you cough or sneeze. Throw the tissue in the trash after you use it. Wash your hands often with soap and water. If soap and water are not available, use an alcohol-based hand rub. Clean and disinfect surfaces and objects that may be contaminated with germs like flu. Clean and disinfect surfaces and objects may be contaminated with germs like flu. Stay home until you are better. If you are sick with flu-like illness, CDC recommends that you stay home for at least 24 hours after your fever is gone except to get medical care or for other necessities. Your fever should be gone without the use of fever-reducing medicine. See other important information for people who are sick.